Hello, everyone. Welcome to part two of our AI in full bloom spring series. I'm your host, Dan Murdoch, and I'm excited to dive into all the ways that AI is being utilized across charge entry and coding, maximizing accuracy, ensuring efficiency in this area, minimizes downstream denials, and increases speed to cache. I'm joined by an absolutely perfect guest who knows all of the above. Andrew Lockhart, CEO and co-founder of Fathom Health, an advanced AI coding software company trusted by major hospitals and healthcare systems across the country. We're going to take the time to explore how Fathom is transforming clinical documentation workflows, the approach they take to working with large health systems, and how their clients are measuring return on investment to ensure these AI-driven solutions deliver measurable impact. Andrew, welcome to the program. And if you could, would love if you could introduce yourself.
Hey everyone, thanks for having me on, Dan. Always a pleasure to chat. So my name is Andrew Lockhart. I'm the co-founder and CEO of Fathom. For those who aren't aware, Fathom, about 8 years old, pure play autonomous coding company. So all we do is use AI. There's no human in the loop, and we do support not just some of the largest health systems in the country, some of the largest physician groups, and then also health plans as well now.
Incredible. So, to that end, why don't we talk a little bit about the company origins and what were some of the gaps, Andrew, in particular, and challenges in charge capture and coding that led to you founding the company?
Yeah, I mean, it was just really driven by what was funny is when my co-founder and I got it started. We really started Fathom in the worst way possible, which was we identified a very sweet hammer and went around looking for the nail. We're very convinced the intersection of deep learning and natural language processing would be very powerful. This is 2017, so around this time, Google Translate had switched over to a deep learning engine from a rules-based engine. Um, and we knew we wanted to do something in healthcare. Coding was the thing where, you know, basically it's like, okay, you're going to do something deep learning, then you need a lot of words. So go to the EHR, and we followed the journey of the electronic health record. Coding was the thing that was both massive in scale, impacts, every provider organization, everyone has to do it, and standardized, because CMS drives normalization that is, to be honest, not as normalized as I would have liked, or had envisioned when we got started, but still sufficiently normalized that you can build, a standardized technology solution here.
And in those 8 years, Andrew, what are the common themes or challenges that you've most commonly come across? I imagine there's some semblance of an evolution over 8 years time span, but perhaps maybe there were things that happened 8 years ago that are still happening today, and perhaps there's things that have changed. Do you mind just touching on that for a moment? It's interesting to see, particularly given that you have such a wide breadth of customers in the hospital and healthcare system segment, what that's
Mhm.
looked like.
Yeah, so kind of when we started, um, we were tr really trying to solve a labor supply issue. So pre-pandemic, the average medical coder in the United States was a 54-year-old, typically a woman. Interestingly, during the pandemic, the demographic with the highest rate of workforce abandonment was 55 to 64-year-old women. So you took basically a population that was already, and there was already something like a 23% shortage of medical coders. Um, and then you just put it on steroids. And so we initially started out there, and basically displacing what otherwise would have been work going to offshore vendors, but providing it at a lower cost and higher level of accuracy. Over the last few years, what has become, really fascinating and I think just massively impactful for us is displacing clinician coding. So for those who aren't aware, something like call it like 30% of encounters in the healthcare system on the outpatient side are coded by coders, and the rest rely on clinician coding. And what has been not surprising to me is clinicians despise coding. They hate it. It's a lot of work. It's not what they were trained to do. I mean, they have been trained to do it, but it's not why they became doctors. But then two, the thing that really surprised me is they systematically undercode. So even in health systems where the clinicians are reimbursed based on the acuity of their work, they've also been, rightfully so, reminded compliance of the risks of overcoding, and the guidance around E&M leveling is just, sufficiently fuzzy that most clinicians, if they look at it and it could be a three, it could be a four, they put down a three. And so what we've seen across the board is not only clients are able to, when they displace clinician coding with AI coding, they take that work away from the clinicians. So they have, more mental bandwidth, more time to see other patients. Two, their coding accuracy increases, so overall compliance uh, increases. And then three, we see an increase in acuity. So there's a top line revenue story.
Incredible. And let's take a deeper dive into the product if we can. Everyone's kind of trying to answer the elephant in the room question, which is like, how do I apply AI within RCM or within scenarios across the entire spectrum, front, middle, and back end, and provide like a tangible solution and answer to a problem? I'm curious, from your experience, Andrew, now your underlying technology being fueled by AI and it interacting with EHR systems to support accurate coding and charge capture, how does it in fact interact? And what is sort of like the method to the madness, if you will?
Yeah, so this is another one where the journey is kind of interesting. When we got started, autonomous coding wasn't a category. People were accustomed to computer assisted coding. And Fathom as a product does not have any interface. We just sit in the background, perform work in the EHR. And the absence of an interface hurt us for a long time because people wanted a piece of software that they could touch, feel. They weren't accustomed to, AI just doing work for them. Now, what's happened since then is, Epic is really encouraged Epic clients to keep workflow within Epic. And what I once viewed as like, oh, we need to build an interface if we want to be maximally competitive in coding technology market. It's now actually a benefit. Is increasingly health systems like the fact that we're just something that sits in the background and performs work. So instead of having, you know, 10,000 encounters that need to be coded when, someone wakes up in the morning, when the coding department starts in the morning, there's now, call it 500. Um, and the rest has already been coded and filed to bill.
That's incredible. And I can imagine the feedback that you're receiving from all different dimensions of the organization are like overwhelmingly positive. Can you share a little bit of like the different types of personas that you're interacting with and those that are impacted and maybe some of those sentiments that they're sharing with you guys on a day-to-day basis?
Yeah, so well, let's start from the top. The CFO is very happy because their coding costs have gone down. Well, typically their top line revenue has gone up. Further, their denials have gone down because the coding's more accurate. Just all these issues that might trigger denials, where there might be disagreement between a diagnosis code and a procedure, those things get wiped out with AI. Then obviously the VP rev cycle reports that CFO is very happy. The clinicians, they feel much better about life, not only because they, in a lot of scenarios, are no longer dropping codes at all. They can just focus on their work. But then, two, they're getting reimbursed more. Their RVUs are going up. And so they're getting paid more for doing less work. And then when you talk about coding leadership, they're very excited because rather than they're losing staff left, right, and center. We talked to a lot of health systems where they're just trying to hold on to their coders, give them retention packages just to kind of keep wheels on. Because if you're not coding, you're not getting paid. And instead now, rather than plugging holes in the dam, they have this capacity. And what that allows them to do is elevate their practice, focus more on policy, focus more on the challenges that payers are throwing at them. So how do they think about coding related denials? How can they be more dynamic in their coding guidelines with payer specific things to address some of the stuff they're seeing in the data? Basically allows these very experienced coding leaders to operate at the top of their license and then also uniformly enforce policy. So most of Fathom's clients are now seeing whatever volume they're throwing at it, over 90% is being performed by the system. And the benefit of having a singular coder like that is you can give it feedback, you can change things, and it's applied uniformly. If you're a very large health system, you have hundreds of coders supporting your practice. Re-education every time something changes is extraordinarily challenging.
Yeah, it feels like a win across every single dimension as it relates to how you're impacting everything from top line revenue to denial mitigation and management, and then optimizing labor, like clearly, increasing productivity, accuracy, everything, and hedging a lot of the risk, everything to do with non-clinical talent attraction and retention is something that we continue to see as an evergreen issue. And I'm curious as to all those market conditions assumed and certainly experienced by 98%, if not the entirety of health systems within the United States of America. Do you feel that, where do you feel like we are within the adoption curve of AI as a priority or strategic initiative within these systems? Do you feel like, if you reflect on the last 8 years, do you feel like it's only increased and it's increased by 10x in the last 12 months, maybe 24 months? I'm curious as to what you're seeing and observing as it relates to the appetite to adopt AI to now prescribe to these challenges that have been in existence for an extended period of time.
Yeah, so this is something that I think we have ChatGPT to thank for.
Yep.
Um, they were sort of the evangelist of AI. So as recently as 3 years ago, I'd be on calls with health systems saying like, look, here's what we can do. Here's case studies with large national organizations we're working with. And some people would just end the conversation and be like, I don't believe you. I don't think that's possible. Um, they just didn't believe that it was possible to have this technology. Fast forward to today, basically the expectation is that we do everything. And that's been really exciting for us because, our first health system contracts, health systems will want to dip their toe in the water and be like, okay, we're going to get you started with radiology or emergency department. Now, increasingly, we're contracting for all of their volume. So we're going to perform coding across all departments, and give you true enterprise leverage. And so that's just been a very pronounced difference. And further, the expectations for clients, and rightfully so, is that we do more and more. Increasingly, not just coding is what we're being asked to do. And so I'd say that the expectations for clients are high and appropriately so.
No, it's a wonderful place to certainly be, and yeah, it is quite interesting just to have seen the velocity of which people are now have the appetite and the understanding of how AI can help them. And yes, I think ChatGPT is certainly a huge catalyst to making that a reality. I'm curious, Andrew, if there's any sort of pattern that you're also observing within the types of organizations, whether it be size, specialty, or maturity, that are maybe moving quicker than others to adopt technology like this.
I mean, for us, there still is an implementation lift. And so, and, until we're like a plug and play, sort of like, sort of app store like feature within EHRs, it still requires IT resources. And so, generally speaking, it's going to be the largest health systems that are running towards this because it's very, for how much benefit Fathom can bring, you could amortize a lot of IT resources against an integration. You don't need that many, but it's very easy to do. What I think is an unfortunate dynamic of AI adoption is that the small health systems or single rural hospitals are going to have a lot of difficulty adopting the tooling because there's not the resources to perform the integration, and the EHRs haven't quite gotten to the point where it's super easy to turn something like a Fathom on. And so there's a widening disparity of have and have nots amongst health systems. I think like the top 10, top 15 are the ones that are going to be way, way out ahead.
Yep, I think we're seeing something very similar on our end, right? If they have the right resourcing and infrastructure and hierarchy of individuals who can help not only think about this from the technical perspective that you're mentioning, but also the strategic application, that's where the sweet spot is. And fortunate or not, that's where it exists, certainly in the upper market. So yeah, consistent on our end as well. I'm curious, one last question on sort of the market trends piece. How's the shift towards value-based care or increased payer scrutiny influenced how providers think about charge capture as a whole?
Yeah, so increased scrutiny is probably the best thing that could have happened to Fathom. Um, in that two things with value-based care, ICD coding matters. And so historically in a fee-for-service environment, even professional coders would drop one or two ICD codes and move on. But in a value-based care environment, you want to capture all the ICD codes associated with the visit. That's very time consuming, very expensive. Uh, and so the ROI for Fathom becomes much, much greater. On average, I think we find 1.5 to 2 more ICDs per encounter than a manual coder or clinician in our volumes. And that has tremendous impact in a value-based care environment. Um, with respect to regulatory scrutiny, I think very quickly the gap is widening to such a degree between what you could, affordably manage from a human-based accuracy perspective in AI coding that, you're really putting yourself behind the eight ball to not be using AI coding from a compliance perspective. And I suspect what you're going to see, the payers are using AI as well to audit charts. And what that's going to do is, drive the expectations up. So historically, for example, radiology coding has been very, I'd say, pretty poor accuracy, and it's been widely accepted because the payers aren't going to heavily scrutinize it because it's expensive relative to the cost of the procedures that are being done. But you introduce AI tooling where you can begin to do this very effectively at scale at very low cost. What that is going to do is put a lot more pressure on things that historically, you didn't really need to drive towards super high accuracy, but now you do.
Yeah, I think that's exactly right. And the whole payer provider playing field, particularly at this, we're going to be deploying AI now on the provider side to sort of level that playing field between us and the payer, and how that all nets out will be a fascinating dynamic to see play out over the next few years. But yes, I think we share an interesting mission of like equipping providers with technology that's going to better equip them to be able to get paid for the services that they've rendered and that they're deserving of. But Andrew, this has been an amazing conversation and super insightful. I've one last question for you, which is speaking to sort of like looking ahead and thinking about the biggest opportunities for AI in transforming revenue cycle operations over the next 3 to 5 years. Where do you think that exists? And of course, it could be directly square in the areas that you guys are focusing on. But I'm curious from what you're seeing and what you're expecting, and again, having seen this evolution from like I don't want to touch that with a 10-foot pole to like I need you to do everything now. Like, where do you think we're heading as it relates to the innovation that is eagerly expected and hoped for from different providers across the country?
Yeah, that's a great question. So I'd say from a coding perspective, it's fairly inevitable that you're going to end up with high 90s, maybe even 99% of all coding performed fully autonomously. Um, and so then what do you do with that? And this is what we're seeing with our most forward-thinking clients is they're thinking about, well, how do these interplay with other tools we have, other solutions? How do these connect to one another? What can we do to use denials intelligence to inform better coding? And I think that's really the next wave is, there's a great AI solution in just about every, take the 6 to 10 steps of the revenue cycle, depending on how you want to break down. There's a good solution there. Uh, and I think the interesting question for providers is how you think about stitching them together and where do you focus and find the most efficient sort of uplift in connecting, these sort of siloed solutions.
Undoubtedly. Yeah, and it'll be interesting to see how all that comes together in time. And yeah, we're perhaps closer to that than we think, but um, I'm really excited and optimistic about what this all means as you guys are as well. Um, there's so much opportunity and upside and white space for the providers to be taking advantage of. And um, I think there's an opportunity to certainly like crawl, walk, run a little bit with some of these approaches. And coding feels
Mhm.
like one of those first areas to like get started. And so anyway, we're very excited about where you guys are heading, and we're so excited to be your partner. And Andrew, if anybody wants to get in touch with you or the Fathom team, what's the best way to go about doing that?
So you can email me at andrew@fathomhealth.com. And then, you can feel free to connect to me on LinkedIn or follow me on, Twitter/X.
Brilliant. We'll be sure
Also,
to
both
include
Andrew
that.
Lockhart.
Yep, we'll
All
be
right.
sure to include that within the comments here and in the follow-up. But Andrew, thank you so much for joining me, and we're super excited to see all the amazing things Fathom is going to deliver in the present and in the very foreseeable future.
Yeah. Thanks for having me, Dan. And thank you for the thoughtful questions.
Of course.
Have a good
Thanks.
one.